Welcome to the latest episode of CarePoints. I'm your host, Kenny Schiff, the Chief Marketing Officer for Lone Star Communications. And today's episode is part of my continuing series of conversations with my collaborators at Lone Star, customers, partners like Zebra Technologies, and notable folks in the tech industry. And it's my pleasure to interview Kassaundra McKnight-Young, who is the Healthcare CNIO Industry Principal for Zebra Technologies. So let me set up the episode. Today is going to be a lot about enterprise mobility, clinical mobility, mobile wireless communication devices, tablets, smartphones, IoT devices have an ever-expanding footprint in hospitals, and they're involved in every aspect of patient care and operations in order to support all the things that are going on in the dynamic environment that hospitals have become. What we now call clinical mobility is essential for hospitals as it ties together communications, workflow, real-time data access with the goal of improving patient safety and satisfaction, efficiencies. None of this is magic, and that's really why I want to talk to Kassaundra. I'm excited to talk to her about how to do this stuff the right way. So let's get to know Kassaundra a little bit, and we'll dig into a bunch of questions. So first, let's start. Kassaundra, welcome, and tell us a little bit about yourself, your background, how you got to Zebra, what you do at Zebra, and we'll go from there.
Thank you, Kenny. Thank you for having me. I bring 30 years of healthcare experience prior to coming to Zebra. I didn't start off being a nurse, though. I am a nurse now. I tell people all the time, I never wanted to be a nurse now. I wouldn't do anything else if I could relive my life and start it all over again. I started working in healthcare right out of college in a lab. And then in 2008, I decided to pursue a nursing degree. In that transition, if you remember, 2009, that's when the EHRs started. We started moving from manual to electronic EHRs. And from my previous life, I really helped merge and train the systems that we were using at my previous lab space. And so when we started in healthcare, I jumped right in. And I've always been a problem solver, always been engaged with doing the right thing at the right time for everyone involved. And so in 2016, at the hospital I worked at, because I still do work the floor as a nurse PRN. And so there at the hospital we work at, we were really trying to expand our clinical mobility strategy. And so we were introduced to Zebra's product, one of Zebra's product. And that's how I got to know Zebra, if that makes sense. Even though Zebra was in our hospital, we were using their printers and, you know, wristbands and different things like that. Nurses don't really know who they are, right? They just know that you have wristbands and printers. But actually, when we started using their device at the hospital that I worked for, we didn't have anything. So we were able to really optimize our workflows using those devices. And so we went down from using 5 devices to 1. So it's really a big impact. And so I really started knowing who Zebra was and really believing in what they actually did as a company. Now here at Zebra, I get to work on this side. I get to do what I did at that hospital for 8 years. I get to share all of my knowledge working with Zebra partners and also clients and customers to help them get to the highest clinical mobility strategy they have, or they don't even know they have, right? Or what they think. I'm really just trying to share my knowledge of how you can do the best you can with what you have.
So Zebra is a multinational company in a lot of different verticals, healthcare being an important one. Bringing folks like you into the picture makes it not be so much about the device itself per se, but how to make the most of the device. So let's kind of jump in that direction and explore that a little bit. So based on your experience on both sides of the fence, right? Customer, now working, supporting customers and partners, what are the key factors to consider when implementing mobile devices like smartphones and tablets in the hospital environment? And I'm looking at you more from a nursing perspective than from all the kind of technical stuff that people tend to focus on.
Yeah, I thank you for that. But I think it takes all of it. It takes everything, but you have to have the right people at the table. You have to have the right platform, the right infrastructure. You have to have all the pieces that go together to actually make a successful implementation as well as an adoption. So when you think about that, when I think about that from the clinical standpoint, you have to have the people who actually do the job at the table. And you can't bring them at the table at the end. They have to be brought at the table at the beginning. A lot of people miss that step, and they want to bring in later, and that causes problems because they feel like that leadership has made decision without considering their input. So bring in those people, those subject matter experts, the people who actually do the job on a day-to-day basis to help you talk through pain points, understanding what the true pain points are so you know how to strategize and actually implement is really key.
Yeah, and I would think that little things matter.
Little things absolutely do matter. And when you look over something that small, it can really have a big impact on your adoption later on. As I'll hopefully be able to share just some things that we learned through our processes as we have implemented this technology over the last 8 years.
So when you bring a whole um, bag of clinical mobility tricks to the table from a technology standpoint, there are it's not about the devices. It ends up being about the application of the devices. And for a hospital, there is not one system, there are many systems involved. So, how do you ensure seamless integration between these? And Zebra makes some great technology, their devices, but in the end, their devices are only as good as the things they connect to. So what do we need to do to make sure that and not just the systems, the workflows that are associated with those systems?
No, I, Kenny, as I said earlier, is the having the right people in place from all avenues, the partners, Zebra, third party vendors, the EHR, the actual organization, and taking the steps they need. One thing is bringing in any type of device with the integrations or adoption is network assessments. If you don't have a good network assessment to say you can take on this new technology that you're going to try to implement, you're going to have problems out the gate. You won't have any adoptions because you're going to face connectivity issues. And then a lot of times people want to focus on the device or think it's a device. It's not a device. Like you said, it has nothing to do with the device, and you haven't done a good network assessment to say what you need, what type of APIs, do you need to drop more lines and things like that. That's one aspect of it. You also have to have the right people from each of the different systems that you are trying to integrate to make sure that the proper testing has been done to show that you can integrate. A lot of people just say, yep, we can integrate, but nobody has actually done the proof of concept. I'm a proof of concept type of girl. I don't like to come out here and speak and say, yeah, we can do that without me knowing without a 100% we can do that to see it in action. So I keep talking about the right people, the right platform, and making sure you have looked at every possibility. If you want to be able to drop alerting and you want to be able to send alerts through your devices, you have to make sure you've done the work behind that. You have to make sure that even making phone calls, that you have the right PBX system. You talk about the director. You have to think about everything. And even going back to the pain points, when I said bringing in a subject matter expert, just because you want to make a phone call and you can make a phone call, that's great. But me as a nurse, I want to be able to have a directory. I want to be able to have those quick speed dial numbers, the frequently called numbers. I want that in my hand. So that's when I say bringing in the right people to understand not only that, yes, I want to be able to make phone calls, but how do I want to make phone calls? All of this is important. So you got to make sure again the right people are there, and it takes time and it takes you to invest into the right people to understand what you need. Proof of concept, testing, all of those things are crucial when you're doing those integrations.
Yeah, so you can't just go online, buy a bunch of devices and drop them off and say, see you later, and they'll just work. There are all this preparation that you got to do.
Yes, I have had the experience in my role here at Zebra and prior to my role at Zebra, talking to other organizations because they want to know how are we so successful in our implementation. They bought devices and they haven't not been able to implement, and so they've come to our organization and they ask me. They walk around the hospital. They ask us about problems that they have, and how do we do it? And I spent many years sharing about our success and what we did because people want to implement. They want to implement correctly, but we did the work. We did do the work, and as you said, you can't just buy a device and just drop it off and think it's going to work. There's a lot of mappings, technical stuff that I don't even know anything about. I just know from an end user perspective, I know what I want it to look like, and I just tell my people this is what I want to happen, and then they make it happen.
All right, good. Let's shift into training and education because a lot of success is dependent, as you are saying, looking at the whole picture, right? And adoption is not only the project deployment, but it's what happens as you roll it out and what happens after you roll it out. So, what strategies do you guys use to train nursing staff, or that you advocate for others to use as they are looking at training nursing staff? And not just nursing staff, we know that workflows involve other professionals in the health system. So what are the right strategies in order to make sure that people know how to use these devices and the workflows that are associated with them?
There's several strategies, of course, that you can use when you talk about training and education with technology, mobile devices, or different things. Of course, some people use um, online training. They do hands-on training. It depends on what they're implementing at the time they're implementing to decide which training module or training strategy works best. At the hospital I work at, we actually were in development of our actual EHR, the mobile strategy. So everything wasn't ready at the time that we actually implemented. So initially we did end up taking class. We did class education. But after that, we end up having to do open houses and just at the elbow training because as new functionality was coming out, we were releasing it and we would just help house these open houses to allow people to learn more about it. But I do want to go back and say we do advocate, I recommend and advocate for a super user program. Any hospitals who don't have a super user program, I really advise them to really invest into a super user program. Get people who really want to be those early adopters who really want to understand the technology and who are passionate about it, enthusiastic about it, who want to show other individuals how to use technology. So having a super user program is key and essential. I recommend that because even with the implementation standpoint, even though you may have vendors out there and different people, the training department to help you, if you have those super users there, they are additional trainers and additional workforce that can really help when it comes to the implementation. So I absolutely advise a super user program that again allows for um, the everyday clinician to get involved, to get them to be interested and concerned about the technology of how technology can really help them and really support their job and not hinder them. That's really, I think, a really misnomer when you think about technology. People are afraid of the technology because they think that it's more work, or they think technology is always about making things faster, and that's really not it. Technology is really here to make things more efficient and safer. Those are the things that I would want. I want efficiency and I want safety for not only the patient, but also the clinician.
So the whole super user thing, this is not a third party that shows up, see you later, they're gone. These are people that live inside the institution that are peers. They're just like the people who other people are using the technology. They just happen to be a little further along in their technology journey.
Yeah. Yeah, absolutely. It's the people that work in the hospital every day with you. And I said super user program, and I don't want people to think it's just focused on nurses, right? Your super user program can compromise whoever is there to support the technology. Like even if I was a unit clerk and there was going to be some upgrades that I need to focus on as a unit clerk, you need a unit clerk super user. And people don't think about the benefits of a super user program as I'm stopping to talk about this. But even as you're thinking about logging calls to the help desk, if you had a super user that was there and identified on that unit, people could just go to that super user and ask. More likely, the super user may know the answer. So it would actually reduce the calls that you have or the tickets that's being logged if people just have simple education questions. And as you know, no matter what you implement or computer train or whatever it is, if people don't know how to use it, then the adoption is going to be low. And so, as I have been going out as a Zebra employee, sitting there watching workflows or asking questions, they'd be like, "Oh, I didn't know that it could do that. Oh, I didn't know that it could do that." And so that's where people won't use the device because they didn't even really know what they actually can actually do. So again, education and training is important not only for just using training, but actually adoption of that technology.
So let's piggyback off of your mention of workflow optimization. So um, let's talk about some examples where mobile devices have really improved the efficiency of a hospital.
This is my favorite subject. I One of the things I talk about all the time, or I say, I have a T-shirt that says, "I have 99 problems, but workflow efficiency is not one of them." And the reason why I say that is because if you would have asked me 15 years ago, or that I could use a handheld device to help me do my job as a nurse, as a bedside clinician, a patient care tech, as a EVS person or a transporter, PTOT, I wouldn't have believed it. I would not have believed it. But I am not only a believer, but I'm an advocate of what you can do with a handheld device because I've had the experience over the last 8 to 10 years to really implement some magnificent changes at the hospital that I work at. One of the things I mentioned earlier is that we were able to stop using 5 devices and consolidate it down to one. That's one key feature when you talk about workflow efficiency.
Yeah, and when you talk about 5 devices, you're talking like pager,
Page,
phone.
yes,
So you
phone.
get rid of the tool belt.
Yes, I get rid of that's not a tool belt, Kenny. I tell people all the time it's really a backpack. We're trying to get to a tool belt. So I believe using the word tool belt is a misnomer unless you are really using 1 or 2 devices to actually do your job. So I want to get people from using that nursing backpack to that tool belt. But absolutely. So device consolidation is one thing that you can do. You also can, when you think about workflows, you can administer medications. Everybody think about that. You can, but not just with the administering the medication piece of it, you can do smart pump programming, which is when the physician puts in the order in the electronic EHR, electronic health record. When I scan the pump, it can pick up that order that the physician has put in. So then that prevents me as a nurse for having to manually key that in, risking the chance of me putting something in wrong or even overriding the system when something is not, when I'm trying to put medication in. So huge safety concerns there. So smart prep program is another feature that can be used and something that we implemented at the hospital I work at. We do bedside collection at the bedside with specimen collection. We administer blood transfusion at the bedside. And another thing with that, at our hospital, we also have removed the second nurse because we can scan. And not only that we scan, but through our EHR integration, the system that we use, you cannot manipulate the scan. So what that means is I can scan and I can't change it. So therefore, whatever's on that blood bag, expiration, the unit number, the blood type, all of that information cannot be changed. And because that cannot be changed, we do not require a second RN to verify because our scanning is our second, is the positive patient ID. So that's huge in helping with clinician workload reduction because, as you know, with the shortage of staffing of nurses, sometimes you only have 3 or 4 nurses on a unit, and I got to go find you to help give this blood. And you know that there's a time constraint when administering blood, when it's taken from the blood bank, you have a certain amount of time to start administering, and other guidelines that you have to follow. So that's one aspect. Of course, you can get alerts through the system. You can take through your using your device, using the integrated platforms. You also can take pictures. I don't know what you can't do. One hospital that I visit, they through their RTLS structure that they already have, they have a locator app where you actually just when you need a bladder scanner, or even if you're looking for a certain person, you just actually go to that app and search them, and they tell you where they are. That is what I call innovation. That's what's so amazing to me. So I always tell people, if you can think it and you have a clinical informaticist, hence nursing informaticist, that can really help you support and get there, you can really do amazing things and things that you can't even think of. At the hospital I work at, we optimize workflows on top of that, not just the workflows I mentioned, the common workflows, but we actually send consults through there. We had a problem where we were trying to reduce the length of stay of the behavioral health patient in the ED. So we created an electronic order that fires. Once that order drops, it alerts the behavioral health specialist that this patient needs a consult. So we can track when the consult was ordered, when it was answered, when it was started, and when it was ended, to really help decrease length of stay of that behavioral health patient. So whatever you can think of, you can do it. Lab results, all of those different things. So the possibilities are there. I mean, I could talk for 2 hours about what you can actually do. A lot of people have moved to a translation app. I mean, absolutely brilliant, where I can do that one-stop shopping, to do what I do, that one-stop care to do what I can do as a nurse, not just inside the 4 walls, but also outside the 4 walls as well.
Yeah, and just in terms of the things we talked about earlier, if you have a well-designed infrastructure and the right kinds of devices that are reliable, that are properly implemented, then, as you say, sky's the limit, because then you have a strong foundation along with the necessary training and support and rollout programs where you can, once you have that solid foundation, you can then exponentially grow so that somebody who is working in the field can say, hey, we already did this way. This is something that's just like that. Let's add that on. And then you can just go from there.
Absolutely, absolutely. I think I say it all the time. If you can think it, it can be done. So, I mean, we just recently, my CMIO, the chief medical officer information officer came to me because we were going to have a policy change. And the policy change was changing how we remove and change chronic indwelling catheters. And we were going from 14 days to 7 days. Most people don't stay in the hospital 14 days. So that actual policy use didn't come up that often, but we were changing from 14 to 7. And so he wanted to make sure, what could we do to make sure the nurses would follow the correct steps to do that if we change the policy from 14 to 7 days, since it was going to come up more often. We ran those steps through our mobile device, through our messaging platform on our handheld devices, and that wasn't a device. That wasn't a device issue. That wasn't DHR. That was us thinking outside the box. So when I say you have to have the right people in place, that's the right people in all platforms. A lot of hospitals have stopped using informaticists or are decreasing informaticists because they've implemented their EHR, but that's just the start. We're needed because it's about workflow optimizations. I only gave you a snippet of things that we've done at our hospital. We've done so much, which doesn't have anything to do with the device. What I do is I look at all my pain points. If we have a problem, I say, how can we run it on our device? And that's what we do.
So let's shift gears slightly and just pick up on some things you talked about. And let's talk a little bit about patient safety. So you have this mobile device, you're tied to the EHR. A lot of people in varying roles have those devices. They work throughout the facilities. Patient safety, especially in the environment where there are staff shortages, less people to take care of things, how do the mobile devices play into the whole patient safety thing?
We've talked about this earlier. It's several ways that it can. Of course, you think about the scanning piece of it. So the patient positive ID, whatever the workflow is, if you're scanning, you do those 7 rights: right patient, right time, right medication, right dose, right route, all of those that goes with, med administration, blood, specimen collection, and as well as breast milk and spark pump program. And so that's one key that keeps the patient safe. You also have access, real-time access at your hip. You're not tied to a computer. You're not tied to a workstation. You're not pushing it. So any changes that goes on with the patient, any stat orders, you don't have to be sitting in front of a computer to actually get those orders. Any changes. So I think about the alerting of a patient, like early warning system alerting. Normally, you would have to be at a desk to get those, or a pager that may or may not work, and you can get those alerts. So if a patient is decompensating, faster intervention and collaboration with the right teams to apply treatment, or also even upgrade that patient to a closer monitoring system unit, is critical. So real-time access, huge, of course. And then everything you can get from positive patient outcomes. When you think about wound care, I think about wound care, and even let's talk about a workflow there where you can actually take a picture of a wound that a patient has when they come in. First of all, you're going to keep the hospital safe by financially, because if you don't document a wound within 24 hours, the hospital is charged with the care of that wound, whatever that care is. But the thing I like about that to really help keep patients safe is you can be, as a provider, you could be wherever you want to be, and you can call me and say, hey, I'm looking at this wound picture right now. I want to see if this wound is progressing. Can you take another picture? I can take a picture, upload in the system immediately, and that physician can look at that and make treatment decisions based on that. If that's not one-stop care quickly, I don't know what is.
All right. So your employer, Zebra, has some capabilities around caregiver safety. So things like duress and those things related. So safety is a big issue in hospital, not only for patients, but also for staff. You want to talk a little bit about that?
I absolutely want to talk about that. It's very near and dear to my heart. I'm glad you brought it up. I was going to get it in there for sure. The things why I really like about Zebra's duress ability is that all of our buttons are programmable, but there is one button on the back of the device that's red that can be programmed however the organization would like it to be programmed, and they can push it. If they say push it 3 times short, or 1 long, 2 short, whatever they program it as, I can discreetly reach in my pocket and push that button, and based on however we've mapped it, they can come find me. They can come find me, and that's what's critical for me. So I can discreetly call for help without anybody knowing, and they can come locate me and help me. So I think about the situation that recently happened, where clinicians were held hostage. And as I read that, it was very sad, but I know that there's technology out there that can really help.
Let's shift a little bit and let's talk about data. So one of the things, you have this well implemented clinical mobility strategy. You've done all the network readiness that you need to do. You've gone through the implementation, and you have all kinds of great training and things. And one of the things that comes along with that is that the devices know a lot about what's happening, what's happened, and now, because of AI, can give us some sense of what we can expect from a predictive analytics standpoint. So talk a little bit about data as it relates to mobile devices?
Yeah, Kenny, you know, when you have data, it really gives you the information you need to change, right? To make changes, to adapt. And so, what I'm going to say when I think about data management and analytics, you using mobile devices and the solutions that you're using on the mobile devices, that gives not only IT nurse leaders, it gives them the information they need to help drive change for the better for the organization, financial change as well as operational change. And one thing that when I share the return on investment for the hospital I work at, one of the big things we definitely we look at a lot of KPIs. Of course, as a HIMSS level 7 in both acute and outpatient, we have to maintain scan rates of above 95%. So scan rates using these mobile devices. Are we doing that? Absolutely. So using those types of analytics. But also, I talked about earlier alerting. So using those alerting, what has those alertings, using alertings running through the device, what has that brought? What has that done? How can you see that it has improved patient outcomes? One thing that I can say that we did is we ran alerts from our virtual sitter where we watch patients for a variety of reasons. One is falls. So our falls overall reduced by 34%. That happened in 2018. And falls without injury overall was 57%. That was in 2018. We're now in 2025, and each year that number has moved in a positive direction. We've done papers on this and published white papers on this. That's amazing that just being able to run alerts where I can receive that alert that my patient may be in trouble and I can get to the room faster than when I didn't have a mobile device at my hip has been a huge, huge help and a huge ROI. When you're implementing devices, using the data tells you, like, are the devices being used? Are there problems with the devices? We haven't really talked about any challenges that face when you think about devices. Are devices going to work perfect all the time? No. So you need that data to see, like, is it losing connection? Is it losing calls? What does that call quality sound like? So all of that data management analytics really helps with the implementation and your continuing adoption with that. And from the hospital that I work at, that has been one of our successes, is because we look at not just the data that controls the actual devices, but actually what KPIs have we gained from that? The scan rates on not only medication scanning, but blood transfusion. Are they actually using it? And if they aren't using it, why? And let's look at the processes. Do the process need to be redefined? So that's what data management analytics can really do, not just from a device standpoint, adoption, but actual better outcomes for the staff, which will drive satisfaction as well as the patient and positive patient outcomes.
Yeah, the mobile device gives you very specific details about these use cases as they are happening, and tied to the individual, tied to the patient. You have a level of data that 20 years ago we never imagined we could possibly have, which allows leadership to understand the changes that need to be made to continue to drive improvements and outcomes.
Yeah. One of our initial also return on investment, we were spending 49 hours a month scanning in wound pictures. And of course, that's eliminated because we do everything through the handheld device or through a tablet. And so that 49 hours somebody was doing or not doing or delay, you think about all the things that's possible, that is huge.
One of the cool things about somebody like yourself now working for a leader from a product development standpoint is that you have a sense of what's coming. And, you talked about imagination. Well, you're in a position to sort of even imagine further because you're closer to the people who could help bring to life that imagination. Anything more you can say about the wearable? What's interesting to me is that we have seen in 20 years the devices are a lot more ergonomic than they used to be, and moving away from the backpack that you said. So the idea of having something that is a technology that is kind of somewhat invisible or really just not in the foreground, that does things for you potentially in conjunction with AI, there's a lot of great possibilities that can come with that. Can you speak a little bit more to that?
Absolutely. I can share that we do have a wearable. We did release that at HIMSS a few weeks ago. Uh, I can say that that won't be our only innovation when it comes to wearables and that badge, but even what you can do with that wearable, the safety feature on to the rest that we're adding to that we have added to that is huge. It's huge right now. It was huge before that because I'm gonna say I should have said this earlier. In healthcare, we are always reactive, so we don't implement things until death has occurred or a tragedy has occurred. So a lot of people are looking now for things to implement to keep them safe because something bad has already happened. But I really want for us to be more proactive. And I think with our wearable, we're really trying to help with the proactiveness of that, with the companion badge, with push to talk, everything that it offers, and not just for, again, the bedside clinician, PT, OT, EVS, security. I mean, just so many different personas when you're thinking about that, is what I can really say about the badge. Do we have future innovation with our badge? We absolutely do, and I cannot share that. But looking forward to what you said about the whole ergonomics of and a badge that can do more than just be a badge. Absolutely.
Cool. So you want to have any parting thoughts for our audience that you want to share? What did we not get to that you wanted to cover?
I think the only thing I would like to say is that when it comes to clinical mobility, I'm going to say it again. If you can think it, it can happen. Again, 15 years ago, I would not have thought that I can have a device at my hip where I can make phone calls, administer medication, give alerts, look at orders, look at lab values, look at rhythm strips. I wouldn't have imagined that. Run workflows through them. And if you are in a place, because that's where my heart is, I'm a nurse first, but if you are in a place at your organization and you need a clinical mobility strategy, you desire a clinical mobility strategy, I would say look at my pain points and how can I solve my pain points, and can clinical mobility help me? They can. As Kenny said, it is about the right device, the right platform. And so I just want to say, don't give up. Technology is here to help you. We are your friends. I say that from being a nurse and also working on this side because I am a nurse, but I do love my informatics.
All right, cool. Well, thank you so much, Kassaundra, for joining us on CarePoints. I encourage you to hit the like button and subscribe so that you can get notified when we release our new episodes. Make sure to subscribe on your favorite podcasting service or visit us on the web at www.lonestarcom.com/podcast. That's www.lonestarcom.com/podcast. And thanks so much for listening. Looking forward to seeing you on another episode.